Hi, my name is Rafid Hussein. I'm a gastroenterologist at Highpoint Gastroenterology and Liver Disease. I grew up in Chicago, where I spent a large part of my life. I went to an all-boys Catholic high school, followed by Loyola University, also in Chicago. Then after that, I ended up going to Des Moines Medical School, where I spent arduous long hours studying and getting to the position I'd like to be in. I came back to my town of Chicago and worked at Lutheran General in Park Ridge, Illinois. Then, being a glutton for punishment, I trained at Cook County Hospital as a gastroenterologist and became what I do today 3 years later. And my wife wants more of a place where we could spend a lot of time and enjoy the people and the surroundings. So I chose Highpoint Health, and the reason I did is because I like the warm, friendly feeling that the staff offers to both patients as well as fellow staff. I chose gastroenterology for multiple reasons. One reason is because when I was in my first year of medical school, my aunt, who was 46 at the time and a neurologist, ended up fracturing her hip. Come to find out, she had metastatic colon cancer, and that kind of had a major effect on me being my first year of medical school, and my aunt being the baby of my mom's family. She was the youngest sibling of my mom's family, so that had a major effect on me. And also coming from 5 generations of doctors, that also had some influence on me going into medicine, being that my mom and my dad were both doctors, and my mom continues to practice at the age of 88 as a cancer doctor at Cook County Hospital. That kind of inspires me to give my all, giving the best patient care that's possible. What brought me to Highpoint Health is that the providers go above and beyond, offering excellent patient care. My role as a gastroenterologist is more toward preventative care and preventing problems from occurring in the get-go. In a world where healthcare is quite impersonal these days, I practice like an old-time doctor. I think seeing patients face-to-face, talking with them without a computer in the room, without the doctor's back toward the patient, and legitimately and honestly listening to the patient's concerns and addressing their issues wholeheartedly and honestly is the best way of taking care of a patient. Also, I think open communication is critical. If the patient can't get in touch with the doctor, there's really no point in the doctor-patient relationship. My role is to be available, answer questions, give patients peace of mind, and as importantly, provide them relief of their symptoms, whether it be abdominal pain, nausea, vomiting, constipation, bloating. A lot of times these things could be handled simply by listening and prescribing a simple medicine as opposed to multiple medications which patients have tried, such as probiotics and over-the-counter medicines, which just simply don't seem to do the proper job. Without a good patient-physician relationship, there's no point in a patient seeing a doctor. When I'm not in the office and putting in my long hours, which I truly enjoy patient care, I spend time with my family, which now consists of twins that are now in their 3rd year of college. I have a son who's starting college. Both my sons are going to St. Louis University. My other daughter is going to Marquette University in Wisconsin, Milwaukee. And my youngest, who is 15 years old, daughter, will be likely going to high school in Hendersonville High School. I will also be doing a lot of outdoor activities, such as riding a Harley Davidson. I enjoy my 3 pets, which are dogs, mutts, which I adopted from a shelter, and they're our family, and they've been our family for aging between 2 years and 6 years now. And every time I come home, they're always having a welcoming, jumping on me, licking my face, and giving me wholehearted love, which is always refreshing at the end of the day, busy day. Thank you for taking the time to get to know me. I look forward to offering comprehensive care at Highpoint Health.